So that's the Candlelight Vigil, but this event is a Let's Get Loud rally. And as the event poster said that we distributed, and we have buttons that say this, if you're not angry today about the drug poisoning crisis, then you haven't been paying attention. I will share with you that I felt somewhat weary and disheartened this morning in preparing for our protest today. Let's face it, advocates, we've been here before. We've shouted, we banged pots and pans, honked horns and rang bells. We even sang the Twisted Sister song, We're Not Gonna Take It Anymore. Our BC coroner has moved well past the standard announcement of statistics, and in her urgency to share the rising number of deaths, she sent clear, direct, and hard-hitting communication to our Premier and Minister of Health. So I ask you, what do we need today? And the answer is safe supply. So what do we need today?
Safe supply.
We have a 60-page BC Coroner's Death Review Panel document that landed on the desk of our Premier and Minister of Health stating, urgent action needed. The first priority must be to stop people dying, and this will need to include a safer supply for people who use street drugs. So I ask again, what do we need?
Safe supply!
Advocates, drug users, family members, first responders, frontline workers have all shouted loudly for the immediate implementation of safe supply. What do we need?
Safe supply!
We have skyrocketing rates of deaths that clearly indicate the action to date from our government isn't enough. What do they need to put in place?
Safe supply!
I don't know about you, but how much clearer do things need to be? How many protests do we have? How many deaths does it take to wake up our Premier and the Minister of Health? Our current government has failed the families of this province who are left on their own to navigate a bumbling, underfunded system of care. Our current government has abandoned those who face the biggest struggle of their lives. They have turned their backs on those who struggle in full knowledge that the only option people have while waiting for any form of care or treatment is to turn to the deadly drugs offered by organized crime. So I share this with you today. Today, let's not be a whisper. It's time to be loud. It's okay to be loud. Despite our weariness, we cannot stop speaking for those who cannot speak for themselves. We cannot stop demanding that on a human rights level, people must have access to health care that keeps them safe. Our government must listen to those who use drugs, their families, and the recommendations laid before them, and do the right thing in responding to this crisis in a way that saves lives. I don't know about you, but our loved ones matter, and that's why we're here all today. So to help us get fired up for our march to the Ministry of Health building, we have a few speakers. I'd like to introduce Marianne Alto, who has been a long-time supporter of advocacy efforts in Victoria. Shout it out for Marianne. Marianne is a tireless advocate and is a council member with the Victoria City Council since 2010. You put in your time. And you're currently running for re-election as mayor. And you've worked in the area of community advocacy for many years and is keenly aware of the toxic drug poisoning crisis and its impact on families and individuals in our community. I'm handing it over to Marianne.
Thanks, Jenny, and I've been here every year. I always start by saying it's here we go. Oh. How we doing? There you go. Here again, year 6. Is it year 6, Jen? I think it is. And it's good to be here. It's good to see all of you here. I'm happy to see the crowd, and I'm absolutely horrified and disappointed that we're all here again. 10,000 people. 10,000 people. 10,000 people. And we know how to fix this. This sign that's sitting at my feet is part of the answer. There are policy decisions that decision makers can make that will not just slow down these deaths, but stop them. We know the facts, we know the policies, we know the decisions, we know what has to happen. And over again, the message is delivered by people who should be heard, by experts, by professionals, by medical professionals, by psychological professionals, by moms and dads and brothers and sisters. All of these people know what the answer is. And we even get acknowledgement that that answer has been heard, at least a little. And that there's been incremental change, which is great. Incremental change is a good start, but my gosh, it's not enough. And taking that change by increments is letting more and more of our families die. So incremental change is not good enough. And yes, this is an answer that has to be given by several different levels of government, provincial and federal, and at least some of the city. And I'm proud to say that our city has taken really positive steps supporting legalization and regulation and safe supply over the last few years. That's a good thing. But ultimately, we're advocates like you. And we have to depend on the provincial and federal governments to get off their duffs and work together and make the changes we know have to happen. And they do too. There's changes to the criminal code, there's changes to health policy, there's changes to delivery, there's changes to all sorts of policies that the provincial government has control over. So the answer, as Jenny says, is for us to keep gathering, to keep advocating, to keep screaming. I'm going to urge you not just to do that today and when we get to the Ministry of Health, but I'm going to urge you all to put a date in your mind. The first week of October is the opening of the provincial legislature, when all of our ministers and all of our MLAs are going to be in that building that we're going to be gathering at tonight. And yes, this is a Ministry of Health responsibility. Yes. But we also need to get the Ministers of Children and Families, and Social Development, and Housing, and Mental Health and Addictions, and the Attorney General. All of these people have a role to play. And when they get together, they are a powerful group of people who can then work with their partners at the federal government and make the changes we know and they know need to happen and can. And when that happens, next year we'll be here celebrating. And that's what I hope for all of us and all of you. There is no excuse. So courage to you, my friends. It's an honor to be here, and I'm sorry to be here. And I'll be with you as long as it takes.